You'll have heard a lot about change, but what does it really mean to you? What does it mean for the people you care for?
Really just to have the access to people when we need to talk to them. And that, I think that's the most important thing. As long as you kind of got someone to talk to if you've got an issue that develops.
I live at New Milton, that's 6 miles. My son brings me in the car. Other than that, it'd be a bit difficult because there's no actual bus where I live.
We are changing Hampshire Care Services to Hampshire Community Health Care, so you can do your job the way you know best.
We're quite lucky at the moment because other therapists have visited us at home and also have gone into the nursery and the school as well. It's quite nice for us to be able to approach a therapist and say, I'm not sure about what's happening at the nursery or at the school, could you perhaps go in and give them a bit of advice? So that's been really useful as well.
Because they're always there, that's what they're there for, to help you and give you advice and tell you the best thing to do,
It's great to get the opportunity to talk to you all today about the move to Hampshire Community Health Care. This gives us a new name and a separation from Hampshire PCT's commissioning arm, but it means an awful lot more than a new name. What's really exciting for me is that for the first time in a long time we get the opportunity to purely focus on the delivery of community health services. No longer will we be distracted when there are overspends in the acute hospitals and where the commissioners are focusing on recovering those. We are now free to concentrate on transforming and innovating our community health services and delivering really high quality services for all of our patients. So, whilst of course you're going to get new name badges, new headed paper and other logoed items with Hampshire Community Health Care on them, the much more important change is the shift in community health services and the real emphasis this will now give to our patients' needs. We all know how frustrated our patients get when our community services don't join up with GP surgeries, don't join up with social care, and to the patient they don't really understand the differences, and we need to make it as simple as possible.
Well, I've got no complaints about the surgery I go to, they're very good, and when you come here it's wonderful. You get all these people that are kicking the health service, shall we say. They don't think about the number of people or patients that they have to deal with in the short time that they've got per day.
We've been really pleased with the services and everybody works quite well together. So if you have, if you have something going on, then everyone else talks to each other as well, which is good, rather than us having to kind of link in with everybody. They talk to each other without you asking, which is quite good. It doesn't always happen.
We also need to think about when patients are admitted into acute hospitals and making that as painless as possible, and particularly getting patients back into their own homes at the end of their hospital stay in a timely and an easy way. So the whole focus of Hampshire Community Health Care needs to be on innovative, patient-centred care, and I'm asking you all to think about new and imaginative ways which we can deliver community health services. One of the things that the move to Hampshire Community Health Care doesn't mean is that you're going to have to 2p into a new organisation or change your terms and conditions. Your pay and all of your other benefits should remain exactly the same as they are now. The move to Hampshire Community Health Care is much more about a focus on innovative community health services. So what does healthcare closer to home mean? Well, it might mean treating people in their own home, as we traditionally do already, but it might also mean setting up community clinics where we bring groups of your patients in, where you can do their leg ulcer dressing, but it can be much more than that. You might have the voluntary sector there offering them lunch. We might have a diet specialist talking to them about their nutrition and weight management. You might even have an exercise specialist there who teaches them how to become more mobile, doing perhaps a chair aerobic session. So we're focusing on the whole patient and keeping them as healthy as possible. The positive side effect of this is that some of the social isolation that we see when we only treat patients in their own home can be overcome by creating a much more fun social environment in a community setting in which to provide their healthcare.
I feel that I couldn't wish for anything else, because I feel that the treatment that I get from my doctor, the health visitors, and I have no complaint. I'm very fortunate.
Healthcare close to home also means avoiding unnecessary admissions into large acute hospitals. You all know how intimidated your patients sometimes become by the thought of having to be admitted into the large hospital. By being able to provide more services in patients' homes and close to their homes in the community setting and in community hospitals, we can prevent unnecessary admissions and unnecessary trips into acute hospitals.
When I came out of the hospital, there was a lady come from social services, and she got people, you know, carers in to look after me. After a while, you know, I really didn't need them because I felt I could manage myself. I found it very, very helpful because they go into every little detail, practically from your toes to the top of your head. No, I was found very, very helpful. And if they felt that they could do anything for you, they did do it.
We won't be able to do all of this on our own. To make it all happen, we're asking you to work in partnership with social care, with primary care, the voluntary sector, local authorities and Hampshire County Council. For the very first time, budgets will follow patients into the community, so we will have the resources we need to put the care programmes we want into place. We want you all to lead these changes at a local level. You will be empowered with your teams to make your own decisions on ways of working, recruiting new staff, managing your own budgets and ensuring you have the equipment that you need. To make sure our change to Hampshire Community Health Care is improving community health services, we will be reviewing and rewarding staff performance and measuring clinical outcomes.
I think the areas we struggle with is where children are having orthopaedic surgery, which is perhaps more with my physio colleagues, but they will be having surgery and then there isn't necessarily the seamless service across into the community, partly because we're not necessarily involved in the planning of those operations, so we don't know these children are going to be coming out into the community, and then it's a bit of a panic and a rush round to try and find appropriate equipment or appropriate adaptations for the house. So I think that if we can work more closely with our acute care services, that would be good. I've certainly tried to get across to my team that yes, it is a name change, but also it's hopefully a move forward in the right direction as well.
The leadership team of Hampshire Community Health Care, myself, the executive directors and your heads of service and others have all been looking for ways to support you in delivering these clinical outcomes. The Leadership Development Programme and the new Performance Review System are all part of that development. Enhanced opportunities around training, the new Clinical Information System, a very strong clinical governance system are all part of the ways where we want to help you to be able to deliver the clinical outcomes and deliver more patient-focused care.
Living in Hampshire, especially this area, as I say, we're very, very fortunate for care for old people, because some areas people don't get treated the way that we do, and that's why I feel that I'm very fortunate to live in Hampshire, because I think the health care is very good.
This is a really exciting time for Hampshire Community Health Services, and I feel so passionately that we have the opportunity to really make a difference, and this is a fantastic opportunity to develop excellent NHS services closer to people's homes. This is your opportunity to change your mind about change.